today I wanted to do a 2-week update. So it's been 2 weeks since I've had my surgery, my septoplasty and bilateral turbinectomy. Hope I'm pronouncing that right. Basically both these surgeries were done to unblock and help my sinuses. So I'll just quickly do a background. I have done this before, but basically I've always been a mouth breather. I've just found it really hard to breathe through my nose, and even though I tried to breathe through my nose, it just always felt blocked and stuffy. So last year around March I went to see the doctor first, and she kind of looked and then she was like, oh, I think it's made just because you've got one side blocked, and she gave me a referral to go to the specialist. So I went to the specialist last year in March, and he was like, yeah, the glands are swollen, so they're too close together, so that's preventing your breathing through your nose. So basically he put me on the waiting list, and about earlier on in March I think I got an email saying there was a date for me, and I had to call them up and they said, yeah, we've got a date for you, the 29th of March. If there's a cancellation it might be the 15th. But then I realized the 15th of March I actually had class, so I decided to keep the 29th of March because that was a study week. So that meant, you know, I could actually go and have the surgery and not have to worry about missing out on class. So that's basically a bit of background information. Now I'm just going to go ahead and tell you about my experience. So basically I got about on the 20th of March, so about 9 days beforehand, I got a call saying from the nurse, and she interviewed me and she asked me all these questions like, are you allergic to this, are you allergic to that, are you allergic to this, and like my previous surgery experiences. Yeah, and she basically asked me about my previous experience with surgeries and previous like medical history, and then she told me all the details, like the fasting details, and told me that I had to be at the hospital around 9. So the day before the surgery, because I'm currently working away from home, the day before surgery I finished work probably around 4ish, and then I went home to my house and I had dinner out with my family, with my mum. We went to Japanese and then got home and had a few snacks, and then basically I had to fast. So from 2 a.m. the day of the surgery I wasn't allowed to eat anything, and then from 6 a.m. I wasn't allowed to, from 2 a.m. onwards I wasn't allowed to eat anything, but I was still allowed to drink water. And then from there onwards, from 2 a.m. to like 6 a.m. I was allowed to drink water, and then from 6 a.m. onwards I wasn't allowed to have anything at all. So I got to the hospital around 9:12, and I probably didn't see the clinical nurse for my like pre-admission stuff until around, basically both these surgeries were done to unblock and help my sinuses. So I'll just quickly do a background. I have done this before, but basically I've always been a mouth breather. I've just found it really hard to breathe through my nose, and even though I tried to breathe through my nose, it just always felt blocked and stuffy. So last year around March I went to see the doctor first, and she kind of looked and then she was like, oh, I think it's made just because you've got one side blocked, and she gave me a referral to go to the specialist. So I went to the specialist last year in March, and he was like, yeah, the glands are swollen, so they're too close together, so that's preventing your breathing through your nose. So basically he put me on the waiting list, and about earlier on in March I think I got an email saying there was a date for me, and I had to call them up and they said, yeah, we've got a date for you, the 29th of March. If there's a cancellation it might be the 15th. But then I realized the 15th of March I actually had class, so I decided to keep the 29th of March because that was a study week. So that meant, you know, I could actually go and have the surgery and not have to worry about missing out on class. So that's basically a bit of background information. Now I'm just going to go ahead and tell you about my experience. So basically I got about on the 20th of March, so about 9 days beforehand, I got a call saying from the nurse, and she interviewed me and she asked me all these questions like, are you allergic to this, are you allergic to that, are you allergic to this. She asked me about my previous experience with surgeries and previous like medical history, and then she told me all the details, like the fasting details, and told me that I had to be at the hospital around 9. So the day before the surgery, because I'm currently working away from home, the day before surgery I finished work around 4ish, and then I went home to my house and I had dinner out with my family, with my mum. We went to Japanese and then got home and had a few snacks, and then basically I had to fast. From 2 a.m. onwards I wasn't allowed to eat anything, but I was still allowed to drink water, and then from there onwards, from 2 a.m. to like 6 a.m. I was allowed to drink water, and then from 6 a.m. onwards I wasn't allowed to have anything at all. So I got to the hospital around 9:12, and I probably didn't see the clinical nurse for my like pre-admission stuff until 10:18, and yeah, so basically before surgery I had to make sure I had no makeup on, I had a shower and everything in the morning. So I saw the clerk around 10:18, and then she was like, saw my Medicare card and my ID and asked me a few questions, and then she was like, oh, so what's your diagnosis? And I actually didn't know the name of the surgery. Like when I went to see the specialist, he explained it to me, but I didn't really understand. And when I went to the doctor to get a second referral, because I had a referral from one doctor to see the specialist and then another referral before my surgery, it's like, oh, I'm pretty sure he said, oh, it's septoplasty, that's probably what you're having. Anyway, the nurse was like, what's your diagnosis? And it didn't actually say on my referral, so she was like, oh, we'll just write unblocked, and she said the name of the surgery. And up until then I still didn't know what the surgery was called, so, and it wasn't till afterwards I had the post-op stuff that it had the name written on there. Then that's what I realized, the name of the surgery. And I think the nurse was like, oh, septoplasty, that's what you're having. So anyway, I saw the nurse around 10:18, and then around just before 11 my mum had to go shift the car, because you're only allowed, we were worried because we were parked in a 2-hour parking spot. So my mum went to shift the car, and then I got called in by the nurse, and when I came out my mum had actually left. So I was with the nurse for around 12 minutes. She asked me more questions, and it was funny, the nurse's name was actually Emma as well. So she asked me a few questions, and then she's like, do you want to get changed or change later? I decided to get changed later. She's like, oh, you're probably actually better off getting changed later because you'll be cold. So yeah, when I came out my mum had left, so I waited in the waiting room for about another hour until the nurse called me again. Apparently my mum came back, she went to shift the car, and then she came back and someone had told her that I had gone in. And I actually realised later on you could have someone sit next to you until you got wheeled away into the surgery, because I saw other people had like their parents or their partner or someone, but I went in by myself because my mum wasn't sure I was going to come back out because she had gone to shift the car, and then I got called in. Anyway, it was about a whole hour later, about 12ish, I got called by the nurse again, the same nurse, and I got changed. So I took off everything. You're not allowed to wear anything at all, no jewelry, no makeup. She was like, okay, you don't have any jewelry, you don't have any makeup, watch and all that is all that at home. She took my bag, and then I got changed, and I kind of waited behind the curtain, and then she came back and she gave me some tablets. Now I can't swallow tablets, so she like gave me a cup of water, and she's like, okay, that's all the water I can give you, is that fine? So I put the tablet and I kind of chewed it, and then she kind of gasped, and then she was like and then she's like, is it gone? And I was like, no. And she's like, okay, I'll give you a tiny bit more water. She gave me a tiny bit more water, and I managed to swallow the tablets. I think the tablets was some painkiller and some anti-inflammatory or something. There was 2 tablets, 2 different types, I'm pretty sure. Anyway, and then around then it was about 12:20. After she gave me my medication, the doctor came in and is like, okay, are you ready? Do you need to go to the toilet or anything? So I went to the toilet beforehand. Oh, sorry. First time I went to see the nurse around 11ish, I had to also do a urine sample. Pretty sure it was the first time, yeah. I did a urine sample and then I went back out into the waiting room. Anyway, by 12ish, when 12:30ish, when the doctors came in, they're like, okay, so I went to the toilet beforehand and then I got onto the bed, and then it was around 12:01 when I met my anesthesiologist and I was getting ready for surgery. So by that time I was lying on the bed, they wheeled me in. 1:12 the anesthesiologist came and introduced herself and started getting me ready for surgery. I wasn't, the day before the surgery I wasn't feeling nervous, like all my nerves already passed. So when I had the interview with the clerk, she asked me if I was feeling nervous, but I was kind of a little bit. But by the time I saw the anesthesiologist, she was like, introduced herself, and I saw the doctor and stuff. And then she was like, can you poke out your tongue? But I was actually feeling really happy, like, I don't know what it was. She like, poke out your tongue, and like she prepped me, and they like asked me, these people coming in asking me what's your name, your date of birth, and like showing me a sheet, is this you? Anesthesiologist put it into a drip, so I had like a drip and the needle, and she put the anesthetic in through there. And then pretty much after they checked out it was me, they checked my foot and they checked my arm, and she's like, oh, you're actually quite brave, you didn't scream. A lot of people apparently must scream or something when they put the needle in. The anesthesiologist was like, oh, that's a good sign, you can still smile when you're having surgery, about to have surgery. So the doctor came and they wheeled me in, and the doctor was like asking me, oh, have you had surgery before, what kind of job do you do, etc. And I remember being wheeled in to the theatre, but before going into theatre I remember seeing some other people getting prepped. So it was probably about 1:20 when I was in the theatre room, and they were like, can you jump onto, so I was on one bed and they asked me if I could jump onto the other bed so they could operate. But before going in also I had a nice warm towel on me, so I went in, and before going to sleep I could hear there was like, the anesthesiologist was like, how long do you reckon? He's like, oh, probably about 20 minutes. And then slowly I went to sleep. Around 2:15 by the time I woke up, I remember being in the room and there was lots of people, and then they're like monitoring me, and I remember they're like, oh, do you want an icy pole? So I tried to have an icy pole, but it was really difficult because I had to try and suck on the icy pole and breathe through my mouth at the same time. And another nurse was monitoring me, and she was like looking a bit worried because, well, first of all I was shaky, but they said that was quite normal after surgery because you've had a lot of drugs. But then she was a bit worried because she could see my heartbeat. Sometimes it was something about T-zones, and then later she explained to me that I had a little bit of irregular heartbeat. But she asked one of the ER doctors, I'm pretty sure, and he was like, oh, that's fine. Yeah, he said that was fine, so not to worry about it. So that was around 2:15. Then it was around 2:45 I went into my room, and I remember the nurse was like, oh, can you talk? And I was like, yeah. She's like, oh, you're so quiet. And she was like saying to other doctors and other staff like, oh, she's so quiet, she only said 2 words to me. And I was kind of thinking like, I've just come out of surgery, I've got this thing on my nose is blocked, I can barely talk. Plus, like, talking for me afterwards was really difficult. And when I went home, my mum was like, try not to talk because you don't want to strain yourself too much. Anyway, so it was about 2:45, I went back into the room, and yeah, that's basically the whole surgery video. I don't want the video to be too long, so this will just be part 1. You can see some vlogs as well. This is just explaining what happened, and then I'll just quickly talk about, I'm not going to go into much detail, but basically I had to stay overnight, and during the night they came, I had dinner there and checked on me every hour. And I remember I needed to go to the toilet, so one of the student nurses took me to the toilet, and she kind of turned around as I, took my pants down, and she waited outside, and she told me to call her if I needed anything. But I don't think the button was working because I like stood up. I was kind of leaning against the wall and then pressing it, and in the end I just had to go out. And then when I was getting checked, I needed to go to the toilet again, and I remember it was just really hard to go to the toilet, and I had to like literally, sorry for TMI, but I had to force the wee out. And I remember when I had surgery in 2010, it was really also very difficult. And then around 4 o'clock I got a call from my parents, and I had some sandwiches and I had dinner, and the night was just really rough. You can see my vlogs, but if you'd like me to go into detail post-surgery, I will. So basically I just wanted to do this video because it's been 2 weeks since the surgery, and I just wanted to explain what was going on. So I had my post-op last week, Monday. I met with my surgeon, and basically he said he had a look and he said it was still very blocked. Then he explained to me that I had septoplasty. He's like, yeah, so as confirmed you had the swollen glands, so we did that. And then he said also my bone was shaped differently, like the nose bone was shaped differently, so I ended up having 2 procedures done. Because I remember after the surgery, when they had the handover around 9 p.m, I remember the nurse was like, oh, this is Emma, she had septoplasty and bilateral turbinectomy. And I remember she said 2 words, and I was like, I remember when I saw the clerk, she said I was only having 1, but now it seemed like there was 2 procedures. And then on my sheet I realized there was 2 procedures, and I looked it up and it said it was something to do with altering the bones. So when I had my post-op appointment last week Monday, yeah, he said not only were the glands swollen, the bone was also shaped differently. So I ended up having 2 procedures. I think the recovery is not going as well as I would like it. I mean, it's been 2 weeks. If you saw my vlogs, I have recovered, like there's no bleeding and stuff, but I'm still finding it difficult to breathe through my nose. So basically now I have been given 2 months and I have another appointment, but if I feel there's improvement, I don't need to go to that appointment. But yeah, so that's basically my experience. I'll probably do a part 2 video explaining kinda the recovery and afterwards, but this is just the experience and what it was like for me being in the hospital, yeah, staying overnight. So I'll probably do a part 2, but I did do vlogs, you can check them out. So if there's anything you would like to ask me about this, please leave it in the comments below. But I just thought I'll do a video explaining the surgery and, you know, the fasting and stuff. I am still recovering. It could take a couple of months to actually see any results, so I just have to be patient. But yeah, that's my septoplasty and bilateral turbinectomy experience and what it was like to stay in the hospital overnight, and kind of just things I remember. I will definitely do a part 2 where I'll explain from the night to the next day and going home, and then 2 weeks after surgery experience. Thanks for watching. Bye.